Well, good evening, welcome. This is Here's to Your Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Rocky Mount Family Medical Center, and I am so excited to have Kim Langston here. She and I have just met, but I already feel a kindred spirit. It must be the ER type A personality, I don't know, but anyway, we've clicked already. Kim is now the manager, I think, is that correct? Director of the emergency room at Nash General. Nash, whatever it is, it's always going to be Nash General to me. I'm sorry, I'm not politically correct, so just send me a note and tell me how bad I am at some point down the road. Anyway, so we're going to be talking about emergency room and emergency medicine, which is my passion. I literally lived there, worked in the ER at Nash for 13 years, did a couple things before and a couple things after. So, but I love excitement, and I love thinking on my feet, and I love putting puzzles together, and that's what happens when you've got somebody who comes in and they might not be able to talk, or they're spewing blood or dragging a leg or whatever, and so you've got to get them in a room, you've got to assess them, and you've got to figure out what the heck. And most of the time the nurses have got to get some stuff together, because when I worked in the ER, it might be different now, but when I worked in the ER, it is not like on TV where they say, Dr. Jones, trauma 1. I mean, that does happen sometimes, but a lot of times the nurses have got to kind of get it together and fit a few pieces together so that when the doc comes, there's a bit more of a picture than you get when you just roll in or walk in the ER.
That's right.
So tell me, Kim, first of all, why did you become a nurse? What's with nursing for you?
I was living in Roxborough at the time, and a very good friend of mine, her aunt worked for a manufacturing company, and I was in her home. She was fixing us dinner, and she had ulcers on her legs, and they were wrapped up in gauze, and I noticed that they were weeping, and I asked her, I said, why are your legs weeping? And she looked at me, she said, well, I can't afford to go to the doctor. And I said, why? So she told me she was in manufacturing, and she told me how much she made an hour, and then she told me what the cost of insurance would be for her. And I just remember, before I graduated, crying.
Yeah.
I had already been an EMT cadet at one of our local EMS areas before we moved to Roxbury, before my dad worked for CP&L. And when I heard that, I asked God to give me the opportunity to go to school. And I told him if I did, I'd be quiet, I'd sit at the front and do my very best, and that's what I did.
That's awesome. How old were you when you got that calling from that lady?
18.
You were 18. So you hadn't like taken all these biology classes prior to and all that?
No, I had learned CPR as a cadet with EMS, and got the opportunity to clean their trucks.
Yay!
And no, I hadn't, and it was my first job was at Duke, and I am so blessed that God called me into this. I absolutely love it and can't imagine doing anything differently.
So did you staff in an ER to begin with? Or?
Yes, ma'am. I started off as most ER nurse. Well, I was a secretary tech, and then when I finished nursing school, I went back and was a nurse. In 6 weeks, my friends thought it was funny, so they made me charge nurse. I'd already been working.
That's not funny.
Yeah, it was pretty fun. They thought it was hilarious because I'd been working nights already with them for 3 years. So that was a great opportunity. Became a preceptor. And worked nights for many, many years and loved it.
Did you ever become a paramedic?
I did. I graduated both with a degree in EMS and a degree in nursing at the same time.
Okay, yeah. One of my people that I've worked with throughout the last 30 years of nursing did that. I thought, and actually I think she's a nurse practitioner now. I think it was Jenny. Anyway, so I didn't even really know there was a double major like that until I had talked to her.
Yeah, for me, I knew that I wanted to, having worked as a secretary / tech in the emergency department, I had picked up extra time also at Wake Med as a tech, and I loved, like you, the adrenaline rush. I love to make a difference in people's lives. I love to hold their hands during times of loss and hopelessness. We get the opportunity to pray with them. I mean, there's so much to being an ER nurse. I absolutely love it.
Besides pushing medicines.
Absolutely.
And you certainly have to do that. You certainly have to have the skills. And I'll tell you, working 13 years in the ER prepared me to be a nurse practitioner. Because I precepted gazillions of nurses. While I was in the ER, one time the director of nursing came down and she said, "Linda, I've got a bone to pick with you." And I went, "Oh, God." She said, Susie, I don't remember the girl's name, Susie was all set to go to labor and delivery, and she came down here with you and she withdrew her name there. She wants to work in the ER. I'm sorry. But you know, you cross the paths of so many people, and it's just the employees, and it's awesome to work with these women and men, and you know, it's great to have teamwork, and you know that Nick's got your back, and you know, I mean, it's just really important.
I agree. I think I've learned, especially, you know, over the years, when I sit back and think about all the friends that I've learned from over the years, and you know, they don't even know that you're watching them.
That's
you
right.
know, when you watch these nurses, and for me it was at Duke, performing life-saving measures, to
Yes.
watch the residents and the physicians do things. You know, back then we did a lot of open heart cardiac massage, and the things that we did, we saw things,
Yeah.
and I just wanted to be part of that moment with these patients. I was also able to watch the loneliness of people, you know, and how we can make a difference with them quickly. You know, you may only be one person, but to them, you know, if you're holding their hand, listening to them, being present is so important. I mean, yes, the medical care is also important, the diagnosis, the drawing the
Well,
blood.
you know, nursing, we do the whole
Holistic,
picture.
yes.
We don't just pinpoint the problem, we pinpoint everything. So that's the difference between nurse practitioners and PAs, because we're nurses, and nurses think differently. They have different critical care skills, I think.
I agree. I think
Most
so too.
PAs that I've worked with, and I've worked with some fabulous PAs, I'm not putting down anybody, but I know, you know, most of them are fresh out of college and didn't really have any experience, and all they've got is book knowledge, and you know, and you got to start somewhere. I know that.
Right.
But you know, most nurse practitioners nurse for several years before they move on to that advanced practice state. So
I've had some wonderful PAs. Yes, in my career. Initially, you did not see a lot of nurse practitioners
No.
in the emergency department, and as over the years, I think I shared with you, I've been doing this for 31 years. I've definitely started. You start seeing the nurse practitioners in the emergency care, and
yes.
been able to watch them. And you're right, most of them were tenured nurses that chose to go into. I guess carried it one more step.
yeah, it doesn't make you better. It's just different way of learning, and different way of moving into something. So, all right. Now, tell me, are you married, single, children, dogs?
I am married. I'm married, imagine, to a paramedic. He's,
Oh, really?
Yes,
Imagine that.
Yes. He's been, we've both been doing this for many, many years. I have multiple children. My oldest is a teacher at, she now lives in Maryland. I have a 22-year-old, and she's finishing up school, going into dental hygiene, and then my baby is a Wesleyan student.
Oh, here.
Yes.
Right here on this campus.
Right here on this
You're
campus. That's right,
Wesleyan.
yep.
That's awesome.
It is.
Okay, and your husband still works in EMS?
Yes, ma'am. He works in Johnson County EMS.
Wow. All right, so that's already, I got a list of questions here. Did
Wonderful.
you know that?
That's great.
Yeah, because
That'll help guide us.
that's exactly right. That's what we're supposed to do. So, since you've been in other emergency departments, I know this used to be the statistic that Nash General was one of the busiest ERs in the state.
Yes,
Was busier than UNC, busier than Duke. Is that still true?
that is still true.
You see a lot more visits than those two big hospitals. I'm not sure about Vidant.
And actually, I pulled the data the other day. When I looked at across the state of North Carolina, I think I counted that we were there 14th or 15th for the busiest. And when I looked at the Vidant data, I couldn't tell if it was all of the VCOM, all of their community hospitals, or
just
exactly
the
what.
big hospital.
And I think the difference, having worked at tertiary care centers, is that they often, the patient, if they are critically ill when and they arrive in those areas, there's so many resources there, but often the patient itself is what we call packaged, right? So
I sent them from Mass General over there.
Yes, you remember those times. And so, and when they get there, we have a large county that we serve, and our nurses have to have a lot of education about critical care patients.
Yeah. And it's got to be really scary. I mean, number one, you're sick as a dog.
Yeah.
Sometimes you had to fly someplace, which scares the bejesus out of me, just putting them in the helicopter, let alone getting in it with them. And so, there's not only the trauma, the physical trauma, but the emotional trauma.
I agree. I have to say, we have partnered with, we have UNC's Tar Heel 4 on our campus, and they fly, and we partner often with Vidant Health to get our patients out to various, because we actually have a lot of transfers.
Oh, I'm sure.
With a number of traumas that we see.
When I was there, yeah. So why is Mass General so busy?
We serve a large community. I don't think everyone is aware, but we actually serve 7 counties. We serve Wilson County, Edgecombe County, Halifax County, Warren County, Vance County, Franklin County, and our own county, Nash. And so when you look at other hospitals, they'll go on diversion. You remember that? We, as Nash Emergency Department, will not go on diversion. We will serve our county. We're going to serve the outlying counties, and we're going to provide that care for them. So I think, as large as we are in the counties that we serve, we have a lot of great physicians. We work with some of the best emergency physicians that I've ever worked with. They are very kind, compassionate. I have great APPs, nurse practitioners, and our PAs. I enjoy working with them. And I think our emergency department speaks for itself. We really made a lot of change in the last year.
Have you?
Yes, and we are chest pain accredited.
Yes.
We are stroke accredited.
Yes.
We have a wonderful STEMI process. Our door to EKG is less than 94% of the time, 3 minutes.
Whoa.
Yes, and
that's not even hardly enough to get
in the door.
Yeah.
Yes, and so we established a process where as soon as they walk in, we're able to get them registered, and we register them and do their EKG at the same time. We have a wonderful stroke coordinator, Mary Kay Baker. I think she's been on our
I used to work with Mary Kay.
I love me some Mary Kay.
Before she was a baker.
Yeah, yes, and so very smart nurse, and also a previous ED nurse. And she has really done a great job with our stroke program. So we are also stroke accredited. And I think when we hear also, I'm not sure if you're aware, the average age of a Nash citizen is actually 42 years old. So
really?
With that brings a large number of comorbidities, diabetes, hypertension, cardiac disease, and with all of that brings your stroke and your chest pain. And I think as we serve Eastern North Carolina, there's a lot of things to be said about preventative medicine. That's why we partner with our community partners, whether it be our providers or EMS.
I am big on, and my audience knows this, I harp every week. Eat right and move.
That's exactly
right. The smoking is the new couch potato, they say, or the couch potato is the new smoker or something. In other words, it's just another unhealthy lifestyle.
I agree. And we don't, a lot of our citizens get so tied up in working and so tied up in working in school, and a lot of people are just really busy and they just don't have the time to get out there and walk or exercise.
Or cook.
Or healthy, right? It's so much easier just to drive through and pick something up.
Yes, it is. Because I don't like having to work all day and come home and cook. But you know what?
Gotta do it.
Yeah.
You gotta do it.
On Fridays, I work a half a day on Friday, and my treat is I go to the Highway Diner, which is,
Yes.
and I get hash brown potatoes and cheese and egg, scrambled
That
eggs and
sounds
cheese.
delicious.
And now, is it healthy? Heck no, but that's my treat after working all week. So it's okay to eat it once in a while.
That's right.
So tell me about these changes that you've put in place here.
So when we got with our team on our first arrival, we met with each individual nurse and tech that works in the emergency department. We met with our physicians, and then we set out goals as to what we want to do. The most important thing is getting our patient to the provider, right? And so we added, and everyone knows when you walk into the emergency department, it's really scary. Most people do not plan on coming to the emergency department. So we added a provider, which is either a nurse practitioner or a PA in our triage area.
Okay.
So you walk in, we have a nurse now in the waiting room 24 hours a day.
Oh, really?
With a tech. So, and that's even changing. We're now hiring a large number, recruiting paramedics to the emergency department. And I think that has been a real change itself, because when we think about that continuum of care from the time that they come into our department, we have clinical people there to help direct them, to help assess them. You see a provider. We have in triage from 8 a.m. to 12 midnight. Staffed 16 hours of the day, and that's the majority of our volume.
Sure.
And then we've also added a lab tech out at triage, so we get your blood drawn, we get your EKG, and we are also getting your x-rays in our triage area. And that is so that we can help people with that process. Nobody wants to wait. Nobody wants to wait. So, and we really want to get them seen, get them cared for, and be able to make that diagnosis for them.
And just explain to the people out there that, one of the weights, because there's weights in the ER,
Yes.
but one of them is we can get them back as soon as possible, but some lab tests take 4 hours. I mean, or you can only draw labs every 4 hours. So address that a little bit for us.
I think if you don't, I'll walk you through that process, because I think triage is also important to talk about too.
Okay, well, let's start at the beginning.
And so I think a lot of people don't understand when you come into the emergency department, it's not like going to a doctor's office. And so our emergency department actually has 4 different emergency departments in one.
Right.
So we have a pediatric emergency department. We currently see about a little over 12,000 a year. We have a behavioral health emergency department. So many people are aware that that is now a crisis across the United States. Then we have a high...
Let me just interrupt.
Yeah.
Behavior health is, for those of you who don't know, might be somebody that drank too much, overdosed, threatened to hurt somebody. It's part of the mental health process. Okay, go ahead.
And then we also have the main ER. And then in the main ER is our very high acuity patients. That's your traumas, that's your codes, that's your strokes. A code is someone whose heart stopped beating or having a stroke. Or we now see a lot of septic patients. And what that means is they are really infected with a bacteria. So, and then we have our low acuity areas. And as we bring people back, I don't think everyone is aware that there are 4 different areas, right?
So you're going to say, I've been here 2 hours and they took him right back. That's because he's going to an acute area, and your area isn't open yet.
That's right.
Or
And not to mention, when we triage, so the United States has come out with, over the years, we had to quantify how we triage. What makes you a critical patient, right? And so coming up with the UNC, actually Chapel Hill came up with the ESI, which stands for Emergency Severity Index. And we're able to quantify each level of severity. And 1 being the highest severity, and then 5 being the lowest severity. An example of 1 would be someone whose heart stopped, who has been in a terrible car accident. A level 2 would be what we call if if you have a very bad infection and a high fever, so an oncology patient who is neutropenic, that is a true emergency. A level 3 is your abdominal pain, but your vital signs are normal, which is your blood pressure and your heart rate. A level 4 is often like a cough, cold, sore throat, like you might can see in the doctor's office. And level 5 is usually like just a work note or something. And so as we move them through that system, I think it's important. I don't think people really understand what triage is.
Right.
Our door to triage time is 9 minutes, so we can get you to a provider in 9 minutes. So that's amazing in itself.
Yes.
And then as we draw blood, so we have the physician or the provider will see you, nurse practitioner or PA. They'll order lab tests. So we send you over to get your labs drawn. Then we have to wait for those results. And then we do get your radiology exam, right? So if you need an x-ray, well, we see we're on target to see about maybe 72,000 this year.
That's a lot of people.
Patients, right? And so even though the emergency department you don't see, we actually see about 220 a day. During flu season, we were seeing over 300. That is a lot of patients, and you don't see it because we've, I think, done a really good job of decreasing the noise. So it's, I call it squares within squares. But you know, as we move people around, then you start seeing it, and as we move them through, and then we wait for the lab test, and then we wait for radiology. And I have to say, I have great radiology team. I have great lab team. But in that, it does take, you have to run it through machines. You've got to get the radiologist to read it. You may have a lab technologist that has to read the results and input that. And so I would say over the years,
and at the same time, lab and x-ray is still going on in the main hospital. It's not like it's just for you.
That's exactly right. Yes, I mean, we have...
I'm going to stop you right here. We need to take a break.
Certainly.
But when we come back, we'll have more of interesting emergency room chatter and with Kim, and we'll be back in just a minute. Don't go away. Hang on.
That's awesome.
At Down East Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently, so we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Down East Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Down East Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
Looking for an affordable option to treat erectile dysfunction? Ward's Specialty Pharmacy now has low-cost Tadalafil Troche. Compounded Tadalafil Troches are small lozenges that dissolve between your gum and cheek. Many ED treatments can cost hundreds of dollars. Take advantage of Ward's Specialty Pharmacy's competitive pricing. 10 doses of Tadalafil Troches are only $80. A prescription from your doctor is required. Call Ward's Specialty Pharmacy today, 252-459-5544.
The statement in this ad has not been evaluated by the FDA. This product is not intended to diagnose, treat, cure, or prevent any disease.
After my surgery, I was afraid I'd have to go to the Triangle for treatment. So this is wonderful. And the doctors treated me with wonderful care, and that's what helped me through the chemo. They're talking to you with a smile every day, making you feel good. I was glad that they caught it early. I feel blessed. I would recommend this place to everyone.
UNC Cancer Care at Nash. World-class treatment right here in Rocky Mount.
Hi, I'm Richard Goss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports, to compression hose, to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
Welcome back. I don't know why we're sitting so far apart. I guess we don't like each other very much. Anyway, welcome back. This is Here's to Your Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Rocky Mount Family Medical Center. And tonight we're talking about the services of the emergency room of UNC at Nash General Hospital. Is that how it is? I don't know how you say it.
That'll work.
Okay. At Nash General Hospital, and you know, they built that new ER, what is that, 3 years old now maybe?
2014.
Okay. Really?
Yeah.
5 years old already. Wow. And so Kim has been there for about 1.5 years, and she is the director of the emergency department. So we'll go right back into what we were talking about. Of course, I don't remember what that was, but we talked about how many you see in a day, and of that, how many are admitted, you think?
We admit about 17% of our total population. So we have a large number of medical surgical admissions. That is not counting the number of behavioral health. We average about 12.6 behavioral health patients a day. That has increased 3 a day over the last year, which is a fairly large, significant volume. A large number of those are pediatric. So we have yes, and we're seeing a large number of behavioral health, pediatric mental health, pediatric patients.
Are you seeing a lot of the opioid crisis? Is that crossing your doors too?
Yes, I am amazed at how heroin has really just started running rampant.
It's like this big tentacle that just grabs everybody and pulls them in.
Yes,
it's awful.
It is sad. It really is sad. I think I can see that being something that the federal government will have to soon develop a task force for.
Yeah. Well, I think we're fortunate here. I know that they just had some kind of a summit in Raleigh. Governor Cooper was there, and I think they said about 500 participants.
That's what I heard.
Yeah, so that's really good.
It is great.
They're looking at it and trying to get a handle on it. So now, you touched briefly on both the heart accreditation and the stroke accreditation, but just speak to that a little bit more as far as, it's not just a matter of, oh, I want this, can I hang this on my wall? I mean, you have to work to get those accreditations.
So each one of those accreditations come from a regulatory governing body. They have objectives, key objectives that you have to meet. It's all across the United States, so it's not just us. And from those objectives, whether it's door to EKG less than 10 minutes, getting to the cath lab within 90 minutes, EMS on the scene and delivering care, emergency medical dispatch. There's a lot of components that go into these accreditations, and then we, Mary Kay and Tara Joyner from our STEMI process, they go through the data and then they look to see where, if do we meet the standard, where we could do better. We share that at every staff meeting. We share it with our physicians, and it's all about giving the best care we can to our community. We want to deliver that care to our community that everyone deserves, and that is why we take such pride in what we do, because as we were sharing earlier, our hospital family is an extension of us.
That's right.
And then the community that we serve then becomes an extension of our family. And I think getting out the information, we are in the stroke belt, right?
Oh, yes, we
for
sure
the
are.
United States. I'm not sure if, and as you were telling me, you harp on.
I do.
Yes. And so about healthy eating, North Carolinians, especially Eastern North Carolina, we love food. And
the wrong kinds of food.
Yes, and I will say that, me too. So, I grew up on that good stuff and fried chicken on Sunday.
And sweet tea.
Yeah, oh my goodness, yes. And I think that's important. And so our coordinators, Mary Kay for stroke, she'll go out and she actually educates our community on, and I've got some stuff here about what to look for, because we want you to get to the emergency department.
Absolutely.
And so we want you to call 911. If you think you're having a stroke, we want you to call 911. And so they go out, and it used to be where they educated on FAST, and now it's Be Fast, which is we look for balance, we look for eyes, we look for any kind of facial drooping, arms, are you able to move your arms? Speech, are you having difficulty with speech? And then when did it start? That is so important.
Yes.
Yeah, for the families. We really need to know that, because the reason why this is so key to our stroke patients is that we have a certain amount of time that we can give what they call clot buster, right? And so if that's a medicine that we give IV, and if you're outside that window, we can't give it. There's it's not been tested, high risk, right?
That's right.
But they also have a new device, the Mercy Clot Retrieval, where some of our academic centers that we partner with, which is Duke, Wake, Vidant, all of these institutions have that ability, is they take a device that goes in and kind of like a vacuum, takes the clot, suctions it, and then takes it out. So
Really?
yeah, very interesting, like a little cage that just kind of suctions and takes it out, and then we reperfuse the brain. And
Wow.
I know, right? I just love it's amazing
Wow.
what we've come to.
I
So
know.
yeah, and
Pretty soon we're going to have those things like Dr. what's his
Spock.
name? Yeah,
Quack.
that's right. Get my wand. Okay.
would be
I'm
awesome.
telling you,
It is.
It's. I mean, I've been a nurse for 30 years, like you, and some of the things we did back in the beginning, like when we did casts at the hospital, we put an old brick on their femoral and all that, and now it's in your wrist, and you're up and moving and gone and
know.
done, and
We have a great STEMI team. We have great cardiologists,
Yes.
and the work that they're doing for our community. You don't have to go to Wake Med. You
That's
don't have to
exactly
go to
right.
Vidant. You don't
That's
have to go
exactly
to Duke.
right.
We can provide that same level of care, which is exciting because it's all about saving that heart.
That's right.
Right, and so
Or saving that brain. Yep,
Absolutely.
yep.
Very exciting.
And I think it used to be, last time I talked to Dr. Moore, he was still the medical director then, and they had like televised ability to see like neurosurgeons at Duke or Wake or whatever, because we can't get all that high quality here. We don't have probably the numbers that they need and that kind of thing.
Well, I know with our partnership with UNC, our senior administrators are looking at what we need in this community.
Really?
Yes, yes. So we recently had a survey, and they met with, I think, people in the community. They met with, the internal staff, and said, "Hey, what do we need?" And we, all said we need some ologists. That's what I call them.
Ologists.
Yes, and so specialists. We want specialists in the community to serve Eastern North Carolina, because if you go to Vidant, you're 45 minutes away. If you go to Wake Med,
45 to 50
at
minutes
least,
away.
yeah. And you think about the traffic, and then UNC is about almost 2 hours.
Yeah.
Yeah.
Well, they sure have brought in top-notch cardiologists.
They really have.
So I believe that they're going to bring the rest of the ologists that they need to. That's awesome.
Yes, I agree.
That is
I agree. I'm very
awesome.
excited.
And I like the ologist thing. That's good.
Yeah.
Yeah, that's great, because I just it amazes me how much Nash has changed. And they had a cancer survivor day at.
Yes.
I was there
Yes.
Friday.
Yes.
And I talked to several people, and they said, "Well, I went to Duke initially, but then I came here and finished my treatment." And I can't tell you how many of those patients said, "It is so wonderful to have a 5-minute drive from my house, get my treatment, and 5 minutes home so I can lay down and rest if that's what I need to do." Instead of, an hour and a half drive after you've already been through all that, and all you want to do is lay down and sleep, and
you're just exhausted. And
Yeah,
I think
yeah.
Sterling Grimes and has done
they've done
an
awesome
amazing job.
Yep.
And we also have hospice. Yep. So Sherry Allgood, one of our nursing leaders, leads that up, and she's amazing and so committed to that population. And hospice is not a bad word.
No.
I think it's such an amazing opportunity of what we offer this community. A lot of people think of hospice as like a last deal type of thing,
That's
but it's
not true.
No, they're able to provide not only for the patient but also for the families.
And I think that's what's so important.
I do too.
Because we've never lost a loved one before. We don't know how to do it. We don't know what roads to walk down, and to have somebody to kind of guide you a little bit.
Oh my goodness.
And to help you accept the fact that Daddy's going to go. I mean,
Yes.
it's
Right.
just miraculous.
It is.
And the older I get, the more gray hairs I get, the more birthdays I have, the more I realize how important all those things are.
I agree. Me too.
So, all right, well, we're going to take our next break because we're at a stopping point. We went over a little before, and now we're going under a little bit. Anyway, we'll take our next break, and then we'll be right back with more of Kim Langston and the emergency room. Yay!
At Down East Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently. So we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Down East Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Down East Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
Are you suffering from chronic pain, have aches, migraines, or just general discomfort? Ask Ward Specialty Pharmacy about their new pharmaceutical-grade, full-spectrum hemp extract, commonly called CBD. CBD has no known side effects and is available without a prescription. CBD can potentially help with migraines, anxiety, depression, insomnia, and other discomforts. Ask the knowledgeable staff at Ward Specialty Pharmacy about CBD and start feeling like yourself again. Ward Specialty Pharmacy, 3646 Sunset Avenue, Suite 110 in Rocky Mount.
The statement in this ad has not been evaluated by the FDA. This product is not intended to diagnose, treat, cure, or prevent any disease.
It was so great to have my cancer treatments right here in Rocky Mount. And the staff, they are some of the most pleasant people. I remember when I had my first infusion, Brooke was an angel and made me feel so comfortable. And Miss Pat and Kristen, they are just amazing. I couldn't have gotten any better care anywhere else.
UNC Cancer Care at Nash. World-class treatment right here in Rocky Mount.
Hi, I'm Richard Goss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
All right, we're back. Hi, this is Linda. Here's Your Good Health with Kim Langston from the Emergency Department at Nash General. And we've been talking about various things, why you have to wait so long sometimes. And, you know, she said one day they had over 300 people in the emergency room. Well, guess how many beds they have in that emergency room? 68. So you divide 68 into 300, and guess, you know, that's about 5 people in the bed in a 24-hour period. So that you're not sitting on your duff when those things happen.
No, and actually, I mean, I think that's important to talk about when you think about how the nurses care for, and you can speak to that. There is no sitting. There is no.
I remember my husband was in there. He had some chest pain, and I was talking to a nurse that was helping me, and somebody came up from behind me and just read her the riot act. And that poor child, she was, I don't know, 25, 26, she was young, and she looked at me and she said, "Excuse me, ma'am," and she was tearing, and she just went in the other room and just bawled her head off. Yeah. You know, we have to be kind to our patients, but sometimes the patients need to be a little bit kind to the staff too. And I realize people get frustrated and they might not get the help they want when they should have it, and maybe that's true, but you know, nobody there can see the whole picture, and that's what we've got to focus on too. But anyway, that's another soapbox. I'm sorry.
Yep. Nope. You're good.
So, how many staff members do you have in the ER? Nurses? How many nurses?
A lot. So I know we have a total. We have people who from the float pool who come down. We have over 200 employees in our emergency department. The majority of those are our nurses, and then they cover various areas. For emergency department that large, we have to have a lot of nurses. But just like in any business, you know, they come during your busiest time, right? You've got to be a good steward of your money, and then they flex off.
That's right. And to work in the ER, you've got to know that they're going to want you from 11 in the morning till 3 in the morning, because 11 a.m. to 3 a.m. and all those hours in between is probably your busiest time.
It is. We actually, our busiest time at Nash is we start, I call it ramping up around 9 o'clock in the morning, and then our last spike of volume is usually around 9 o'clock in the evening. So, and then you get your terrible stuff in the evening.
Right. Right. So, do you still have a lot of accidents that come off of 95?
Yes, ma'am.
Yeah. I wonder what those numbers are. Do you have that off the top of your head?
I can say that we, as a Vidant, is in what we call our E-rack, which is a trauma rack. The state of North Carolina comes out from the Office of EMS, and so that is our closest tertiary care center. And we are the #1 hospital of sending to Vidant for trauma. So outside of their own of Vidant, you know. Yeah. So we have a lot of trauma that come out of here. I know we transfer about 1,200 patients a year, and a large portion is stroke, and our car accidents.
Yeah. Well, I've sent plenty of people, plenty of places, the burn center and every place else.
Yes, yeah.
So. What do you do about the patients who do not speak English?
We have, well, I don't know. When looking at actually I looked at this when I first came into Nash. We actually don't have a large volume of that in Nash County. However, we have Marty, which is the computer, that we are able to use to help us with many different languages.
Okay, yeah, because it will do German and it will do
They translate for us.
Swahili and whatever
Yes.
whatever you need. Korean they've got. So, okay, yeah, we have some that come into our office that are Spanish and speaking, and most of them know to bring their interpreters. I saw this little couple. They're the cutest little things. And he comes with his phone, and I just say, hola, hello, and then he says, and he gets out his phone and has this interpreter that he uses, because I don't know if it's his family member, I don't know anything about that, but anyway. Okay, so if you think you're having a heart attack or a stroke, you just jump in your car and drive to the ER, right?
No. No. We want you to call 911. 911 wants you to call 911. And so the ambulance will go out there. They are specially trained. Paramedics have a lot of education as it relates to emergencies. They will start your IV. They have medicines on the back of their truck. They're able to start the care of the patient. If you are having and they will notify us, by the way. They notify us, call us in and notify us. And then we are able to rally, if it's a heart attack, we're able to rally the troops, our team, and they come in, our cath lab team come in and take care of that heart attack. If it is a stroke, we will get our device out so that we can have the computer and the neurologist at the bedside. Our attending is at the bedside as soon as they arrive. We take them to the cath lab. So, I think being prepared and starting your care is so important.
Yes, and I mean, I can tell you stories of people who say, it's only 5 minutes, I'm going to drive Daddy, and then Daddy dies in the front seat of the car.
We don't want that. Yeah, I mean, we really want to take care of your loved ones, and I think with the specialty training, as EMS has grown by leaps and bounds over the last 20 years, and the care that they're able to deliver in the back of an ambulance, it's just amazing.
Yeah. So don't ever think you should drive yourself. I can't tell you how many people I send from my office to the ER, and I'm across the street.
Yes.
So
we want you to be safe. I mean, even if it's you driving yourself, if you are experiencing chest pain, if you're experiencing the worst headache of your life, if you are experiencing any problems breathing, if you're bleeding and you can't stop it, 911, and because they can provide the care, they can provide that initial care.
Because your belly, you can't bend over, you can't straighten up, you're hurting so bad.
Yes.
Because the surgical belly is a real emergency. It sure is. So, like you said, they're trained to do that, and they're not going to, And I've had people come in my office, and they've given the nitro. I've already given one. The EMS gets here. If I haven't gotten the IV started, they'll start that. They throw some O2 on them. They'll give them a nitro. So all those things can help so that your end care isn't so severe, because the end of your disease isn't so severe because you've stopped it.
Yes, exactly. It's a continuum. The care that EMS provides, like you said, they can even draw blood in the field now and bring it to us. And as soon as they walk in the door, we get it and we can send it to the lab. I mean, that really expedites care.
Yes,
it really does.
Yeah. So don't ever think you're bothering somebody.
Absolutely not.
Call 911 and worry about bothering them later. Especially our older folks, they feel like, I don't want to bother you, but please bother them. It's okay to bother them. Yeah. So what are some of the common causes of people coming in other than the flu? You got some?
So in our community, of course, we have, like we said, a lot of chest pain, a lot of stroke. As we were sharing with Eastern North Carolina, we have a lot of diabetes in our community, with the average age being 42. We see a lot of high blood pressure. with that, you develop heart disease. You have and then you have issues with strokes, and we have a lot of respiratory disease. Now we have multiple, lots of smoking. We're in East North Carolina, a lot of tobacco out here. People have been smoking for years. Not to mention, now we've got the Juuls and those electronic cigarettes. Really?
That's another pet peeve.
Right.
A friend of mine said, I've hurt so bad that I've gotten some CBD oil to vape. Do you think that's safe? No.
And that's what, when we try to explain that, I mean, it's a product being sold to make money. This is not for your health.
Right. Well, and I don't think anything that you inhale in your lungs
is right.
Except for prednisone when you can't breathe. I'll go for that one.
Racemicam and prednisone, that's right.
So, yeah, and I can, I was just thinking like of kidney stones. I mean,
we do see a lot of kidney stones.
Kidney stones, when that person has that stone and it's moving, it's an emergency to them.
Absolutely.
Because it hurts like heck.
That's what I was going. We do have some. Kidney stones, tea is often a contributor to that. The minerals in our water contribute to that in the state of North Carolina. We have, as we were saying before, we have a lot of mental health. I think there's that we talked about. We'd go on another soapbox, but we have a lot of mental health issues in our community with substance abuse. And then we have our normal everyday, I can't get into my doctor's office, right? Yeah. So, and that's for various reasons. Either they don't have the money, right? The physician doesn't have, or the provider doesn't have an appointment available, which is also a problem. And then when we look for continuity of care in our community, tapping into those resources, some people don't want to do that. They just it's convenient to come into the emergency department. It's not convenient to sit there, but it is convenient. And I'm always amazed, and I don't know, we're going to get on soapbox for a second, but I apologize, that we can wait just with our little beepers at the Cheesecake Factory for 2 hours, but we're not willing to wait in the emergency department for that, which blows my mind.
Yeah. Well, you just never know about some folks. When I worked one time, we had a code. It was a child, and so when a kid comes in, everybody goes because we're going to do everything we can to save that baby.
That's exactly right.
And so I was in charge, and so I was left with the rest of the patients, And so I went from room to room, and I said, I apologize. We have this emergency, and we'll be back with you as soon as possible. And this mama looked at me and she said, well, my child is an emergency. I think her child had maybe an asthma attack or something, and had a couple of breathing treatments, and so she was better. And some people just don't. They just don't get it. And I could have gone on and said, this is a 2-year-old. We've had to intubate her. She's had to have chest compressions. That wasn't going to change that mama's mind, And
I think a lot of people don't realize what that entails, right? What a car accident, how many people it takes. For someone whose heart stopped beating, that takes at least 4, if not 5 techs and nurses, because we have to rotate off that chest so often, every 2 minutes now.
Well, and you've got somebody starting an IV, and you've got somebody putting the electrodes on your chest, and you've got somebody else starting the second IV, and you've got somebody doing the pulse ox because they're turning blue, and everybody can jump in. There's plenty of jobs for more than one person to do.
It really is.
So,
but I will tell you, we do desire. I mean, it is our privilege to care for our community. We really believe that.
I believe that.
And I do agree with you that I think some people do get frustrated with us, but there are so many people that I've met in our community that really appreciate us being there. And so yes, you may have someone who is unhappy with us, but our promise is to them. We want to take care of you. We promise to take care of you, and we'll be with you as soon as we can.
That's right. That's right. All right, we have 1 minute left, so cap off everything you want us to know about Nash General Emergency Room.
We want to take care of you, and so it is important for us, as I was saying, that our work family is an extension of our community, and we are here to care for you. If you are having an emergency, please call 911. We want you to call them to go ahead and get your care started, so that you can get the care that you deserve.
And you know, if you're a vet and you go to the VA, go to the emergency room first, get started, and when you're stabilized and can be transferred,
Yes,
they will work
absolutely.
on transferring you either to the, well, I don't think the VA in Greenville has a hospital.
I think it's outpatient, yeah.
Yeah, but the one, they'll get you to the VA in Durham.
Yeah.
But we've got to get you stabilized first. You've got to stop here first and let us get these things going, and then you'll get to the VA.
That's right.
Yeah.
Yep.
So, well, Kim, it's been a pleasure.
Thank you, Miss Linda. I've really enjoyed it.
It's been fun. We'll have to do this again.
We will, we will.
Yep, we will. All right, you all, we will see you. And I just want to tell everybody, I'm sorry I've been out the last couple weeks. One week I had the flu. I haven't, well, I think I had the norovirus. And I missed 3 days of work. I can't tell you when the last time was. I missed 3 days of work.
Right.
I don't even miss 3 days in a year,
Right.
let alone. And I was just, so I didn't come that week. And then last week was my little Mia's birthday. She turned 3.
Woo!
So of course I
Grandbaby.
had to be there for that.
Absolutely.
So anyway, I will see you next month, next week with more of Here's Your Good Health. Thanks again,
Thank
Kim.
you.
Appreciate you coming.
Thank you.
Good night, all. We'll see you next week.